other states there against New York State. It just, if you could speak in general terms about legislative activity for helping resolve some healthcare disparities, but also with regard to maternal mortality.
So this information actually is very public, so anyone can look this up. The CDC usually has, and March of Dimes, they're very good at this, and the American College of Obstetrics and Gynecology, they have these maps of the United States where you can click on your state and you can see what are they doing in order to prevent people from dying during childbirth. And you can literally, the states are ranked. So California is number one. And to be quite frank, a lot of us look towards the California Collaborative in reference to their safety bundles, which are these packages that they have created. And this is recommended from a national level from all of our national societies, where we're now seeing that the standard of care just isn't met all the time. And we know that moms in certain hospitals have poorer outcomes than in other hospitals. And so, all hospitals are not created equal, as all doctors are not created equal, unfortunately. But how do we bridge that gap? And that's education of our doctors and making sure that we're meeting the standard of care. So one of the reasons why our number is improving from that 12 times for Black women more likely to die than their white counterparts in New York City is because we have done some important interventions. And some of that is our safety bundles, which is basically where the national societies that sort of govern how we function in obstetrics and gynecology put together what should happen if, let's say, you had a high blood pressure, a very severe, very high blood pressure, what should happen? And they will literally list out an algorithm. You should get this medication. Your blood pressure should be checked in this amount of minutes. Then you should be getting this medication if it's still high. So they basically try to create a map of how to standardize care so that we ensure that every woman, regardless of what hospital they're in, regardless of who their doctor is getting the same care, what we know to be best practices.
It's hard when I think about the mortality rates and then ensuing legislation. I think, God, why do people have to die in order to wake people up? What can't we just say? People are going to die if we don't do this. Let's do it.
I agree with you. I mean, it's a sad reality, but it is a part of our reality that something bad has to happen in our society for us to take action.
I think also, you're talking about why do people have to die to change practices? I think that just emphasizes how important it is in our field, where racial biases in our field, just like with the justice system and policing, for what we're seeing, we have to remember that the implications for our field are costing lives. They're not costing dollars. They're not costing, loss of sales or products. And while those things are important, when it happens in our field, we're losing women, we're losing men's lives. And so that's why really this is an elevated topic, because the stakes are much higher.
We've done our best, and I think a lot of people in our field have done our best to accept as much of the insurance as possible. We take Medicaid, we take a lot of the Medicaid managed care plans, but it still seems that patients go without the necessary care because they don't have access to affordable health insurance or to physicians within those affordable health insurance plans.
Absolutely. Unfortunately, I think for the majority of physicians, we see this somewhat regularly, is that women are coming forward and really asking for help. And the problem is, even as a physician, I really don't know what the best answer is to that when you don't have the insurance to access these providers. And obviously that's a very complicated issue that there's a lot of debate about as well, with insurance companies and how they affect patients as well as providers. But unfortunately, we see that all the time.
How do we fix this? I'm sorry. I just had the words had to come out of my mouth. And again, yeah, right, exactly. I know, how do we fix the world's economy and poverty at the same time? We wish we could, right? What potentially can we get involved in, and what can our patients get involved in to help this along? Are we talking about political activism? Are we talking about the system's so big and we feel small, but we don't have to be small.
I think on an individual level, we just have to say, I think just speaking up, And eventually what happens is hopefully that means more organization as a group. And, doctors and patients, both are very powerful groups. And I think we just really need to look for those opportunities to organize and speak out to, whether it's to our politicians, to the insurance systems. We really need a more unified voice, and we do have those national organizations in place, and I think really now is the time to take advantage of those. And if we're speaking as a large, very powerful group, I think that's when we're going to see some change.
This has been Women's Health Weekly. Thank you very much for listening. Thank you very much for joining us. We will have this as a podcast. Please listen to our podcast on Spotify and iTunes and anywhere else you might listen to podcasts. We're all over the place. You can follow up if you've missed our telecast today. Certainly you can see it on YouTube as it will be up, and we do break it up into clips later on so that you can see specific topics in smaller clips. Thank you very much. We will do this again, and we will invite Dr. Bennett back and Dr. Dada back. I hope everyone has a very pleasant weekend. Stay safe and be well. Thank you very much.